We're here at Children's Medical Services for Whole Child Leon's Free Developmental Screening Day. We're in our 4th year. We are excited to have more than 25 agencies here volunteering their time and services to see the children get off to the best start in life. Walked in the doors today, more than 150 volunteers. We have family nursing students. We've got all kinds of providers here connecting families to the resources as the children are screened. We are grateful that the community understands the importance of this and has turned out today.
So this is part of the Leon County Whole Child Leon process, where we come together as a community and we bring together a number of resources without basically any budget. Bring all agencies together. They come together to review and evaluate and screen children. If it wasn't for Whole Child, this wouldn't have been possible. So we started in 2009, started our first screening, which was in October of 2009, and we've been doing it now since for the last 4 years. We've done approximately, counting today, almost 400 children. Normally, families, if they did this through the private sector, this would cost about roughly between $1,200 to $2,000 to get the full range of screening. We are providing them the service for free. And the key part of it is, if it wasn't for Whole Child Leon and making sure we have a community where children can thrive, this would not have been possible. So as another example of collaboration and cooperation between agencies and bringing agencies together to doing something good for the community.
We do this to screen children from 0 to 5, basically, for any kind of concerns regarding their development, whether it be physical or dental or behavioral or emotional, hearing, vision, whatever. The reason for doing that and for bringing these children in is because if we can pick up these deficits or these areas of concern and get them further evaluated and get these children into the appropriate care, we can impact not only their development in a positive way, but their school readiness and sometimes their overall general health in a very positive manner. We know that there is a window of opportunity in the first couple of years of life, and certainly within the first 5 years of life, that if children can get the help that they need in terms of developmental issues, that it makes a huge difference later on, not only in their general lives, but in their ability to learn and to participate in age-appropriate activities. So this is an effort that is a totally volunteer effort, where different agencies in the community come together for one day, twice a year, and we screen in the ballpark of 50 plus kids. I think we have 70 kids scheduled for today in all the areas that I previously talked about, and make sure that if there is a positive screen in any area, that child and family is linked up to the appropriate service before they leave this building. We have a whole room of representatives of the different services available to children in our area, and so there's a representative there, the parents taken there, and a connection is made on the spot so that a follow-up plan is in place by the time they leave.
Well, we're doing the early screenings here because prevention is obviously a very important part of dentistry. If you can avoid the problems at an early age, they can save a lot of money and time in the future trying to correct them.
I brought my son to the screening today. I heard about it through his preschool. Came to get just an opinion and see where he's at developmentally, where I can help to boost him up a little bit if there's any sort of services that might help improve his educational experience. We've had a great time and gotten lots of great information, many helpful resources that we found today.
My name's Susan Ellis. I'm a licensed clinical social worker in town, and I am a co-chair of the Capital Area Infant Mental Health Association. We are so excited to have this developmental screening at Children's Medical Services. And so many times young children go to their pediatrician for a quick well child check, and items are missed, development
So milestones are being missed, or they're just not getting the in-depth kind of developmental screening that we're hoping all children in Leon County would be able to have, so that they can pick up on also not only development like gross motor, fine motor, speech, but also on social emotional well-being, and how are they attaching with their caregivers, how are they doing in childcare. So we really have just a wide, diverse ability to catch things that might otherwise not be detected.
The best part about this is that the families go through the screening process. We screen developmental, speech and language, vision and hearing, height and weight, and they get a chance to see what our expectations for children are at that age. And then if there are some concerns, they're hooked immediately up with the agency that provides that service. So that's a terrific thing for families. They see the face behind the person calling them to get their evaluation. So I think that's good. But I think the most phenomenal thing is that we have over 30 agencies providing people volunteering today. No one's paid. We all are working in our other jobs, but come here as a volunteer, leave all of our work at our desk behind. And we also have many students that are here that get an opportunity to see firsthand agencies working together and see what children could be, what kind of services are available for them. So I think it's just a terrific effort for the community that we all come together and do this. I think we have over 100 volunteers